be able to get to all of them, but I will do my best to ask the questions that you submit. If you'd like to submit a question, just look at the bottom of your screen and you'll see a couple of little bubbles where it says Q&A. Feel free to type in your questions, and I will do my best to read them off to our consultants. Let's start off then with just a few words of introduction. Peter, Olivia, go ahead, and whoever wants to go first to give us a few introductory remarks.
You want me to go ahead and do the data?
Why don't you go ahead? That's a good place to start.
So we'll start off with the data and where we are in Sacramento County at this time, and then we'll move to questions and answers. So we have 22,755 cases to date, and we're down now to just under 7 per 100,000, which is an important measure when we look at the color tiers, which I'll talk about in a second. We have 3.8% test positivity, which very simply means that of the tests that are done for the virus in Sacramento County, 3.8% of them are positive. So that's well under 5%, which is considered good. We have 119 hospitalizations due to COVID. 31 of those people are in the ICU. That's down 2/3 or more from where we were in July. And there have been 426 deaths, tragically. About 47% are 80-year-olds and greater, 20% 70-year-olds to 79, 18% 60 to 69, 10% 50 to 59, then 3% 40 to 49, and 1% in the under age 30. So obviously there's a much lower death rate, but it's important to point out that especially as we learn more and more about the virus, there can be very serious consequences of the illness. And we can talk about that later on. The governor has set up a tier system, a colored tier system that basically goes from widespread widespread of disease to substantial, to moderate, to less so. And that's the most substantial, the most widespread disease is the purple color tier. Why it's purple, I'm not sure, because the next is red, which normally would be the deepest end, but anyways, the second is red, then orange, then yellow. And where we are in the tiers matters in terms of how widely we can open up as a community. So we are now in red, and we've turned red about 4 or 5 days ago. If we stay in red for 2 weeks, which means another week and a half or so, schools can open, but they do not have to open for in-school learning. And we can talk much more about that as we go along. What being in red allows for a sort of a judicious opening, partial opening of parts of our economy, like the restaurants can be indoor restaurants for 25% of capacity, movie theaters 25% of capacity, churches 25% of capacity, or 100, whichever is less, and fitness studios 10% of capacity, et cetera, et cetera. So it's instead of the wide open community economy that we had back in June and May, late May and June and July, this time we're being much more judicious and sort of surgical about it rather than a blunt force. And we're limiting the amount of capacity. I should point out that one of the things that Olivia and I wanted to have in the health order, but we didn't put in the health order, was for indoor dining, we strongly encourage just family members to accompany you to indoor dining. CDC studies have shown that indoor dining can be a little bit more dangerous. And if you're going to take friends and family, friends and extended family, go outdoors, which is allowed in restaurants, and obviously with social distancing as well. So we now have a campaign running. You may have heard of it, you may not have heard of it, called Turn Sacramento Orange by Halloween, a cutesy campaign, but it's important. And the reason we did it is for a couple of reasons. Then I'll explain what it is. Number one is there's a lot of message fatigue in the community. People have been hearing the same messages over and over again for 7 or 8 months. There's even more than that. Individuals think that they can't make a difference in how Sacramento County opens up or doesn't open up. So what we came up with is 3 concrete actions that everyone can take for a 5-week period between October 1st and October 31st, Halloween, that we think will get us to orange. And those 3 things are wear a mask indoors at all times except in your house. Second, social distancing inside and outside. And third, no indoor gatherings of anybody outside of your household bubble. Those 3 concrete things that we think people can do for a 4 or 5-week period will help us turn to orange. So let me move to what it means to be in orange. In orange, obviously, which is, you go again from purple to red to orange. In orange, we have a small enough number of cases that our contact tracers should be able to take care of all of the cases, which was not true when we were in purple, right? So we have the contact tracers that can take care of the cases, and the fact that we have a very rapid turnaround now of our testing so that people can get identified quickly and they can be, and their contacts can be quarantined quickly. We now have turnaround times of between 12 and 36 hours, which is remarkably good in terms of our tests compared to where they were maybe a month and a half or so ago. So again, from a public health standpoint, we can manage the COVID if we get it to orange level, and orange level, to put in perspective, is about 45 cases a day. We should be able to, with our, 90 or so case contact tracers, Olivia? With our 90 or so people, should be able to manage that. So from a public health standpoint, we can manage the COVID, and economically, it allows for the opening further of places like restaurants and gyms and movie theaters to 50% in general. So that's the way to get the economy moving again to some extent, and to do it in a safe public health manner. Let me finish up with flu shots and COVID vaccine. Flu shots are crucial. You may ask why, because the flu is different than the coronavirus. They're 2 different viruses, but they have similar conditions, similar effects, and they affect the same kinds of people, older people and those with underlying health conditions. So we have 17 sites in Sacramento County that have already started in action that are giving out flu shots. We are likely to have a drive-through at a large institution in the near future in early November. And the flu shots are important because it decreases the disease load due to the flu, so that if there is a second wave of COVID that may need ICU beds and hospitalized beds, there will be enough beds available for people with COVID. And that gets me to COVID vaccine. We can talk further, and this is just surmisal on my part, but it's educated surmisal, is that COVID vaccine will probably come out sometime in early next 2021, next year, January or February. But that does not mean that people are immunized against it or vaccinated against it. That obviously comes from vaccination. So learning our lesson from what has happened in the past year or so, past several months, where the federal government has not necessarily come up with appropriate material to be able to get testing done, for example, not having enough swabs or whatever. We have actually bought with some of the resources that we got from, or we're buying with some of the resources that we got from the Board of Supervisors, syringes, refrigeration stuff, all the kinds of things you would need to give a COVID vaccine, so that if it comes out and we're able to at least immunize seniors and healthcare workers first against the virus. So with that, I'll just tell you that we've gotten about $70 million. Olivia was very instrumental in her staff in getting this. We've gotten $70 million for COVID-related things from the Board of Supervisors, and those things are used for testing, business reopening navigators who go out and help businesses on how to reopen safely, contact tracers, community testing centers, and the community testing centers, of which we have 11. They also have a lot of community outreach with the cultural group that they're associated with. Lab improvements, PR campaigns that are multilingual, additional staff, and encampment services, and Harvest for the Healthy, which is a very interesting program where we pay people who are agricultural workers or day workers to isolate and quarantine if they test positive, so that they are not, so that they stay away from work instead of going to work because they have to work on a paid hourly, and they would otherwise be going to work and potentially spread the disease. So that's a synopsis of what we've been doing in large part, and our public health division has been phenomenal, as Steve was mentioning, in working on this around the clock, to the point where we have to get them some surge capacity staff to help them out. So I'll stop there, and we'll be happy to take questions.
Dr. Kasirye, would you like to make a comment or two before we go into questions?
No, I think we can go straight into questions.
All right. Let's go ahead and do that then. There are quite a few that have been submitted. And we'll start with something that really has to do with the opening. Christopher Fisher asks, how does the county's move into red affect youth groups like Boy Scouts? Does this mean we can start meeting in person?
Olivia?
So Boy Scouts actually is covered under the cohort guidance. So right now they can meet in person, but they need to look at the cohort guidance in terms of the sizes and the kinds of activities that they can engage in.
There are a couple of questions about the dashboard. First, this is from Nina Withers. I'm trying to understand the COVID-19 dashboard on your website. I know that the positivity rate is calculated weekly, which determines where we fall in the colored tier system. What does total positivity mean in the dashboard?
That's, as I think we described, of the number of tests that are done, what percent are positive. So right now we're at 3.8%.
And just to add to that, the total positivity probably that you're referring to is overall from the time that we started tracking COVID-19. That's different from weekly, where we, on a weekly basis, we also track because we want to see that going down. But so both are important, but they cover a slightly different time frame.
Right, that's right. And it's 5.5% total positivity, which has been the total positivity since we began.
Correct.
And here's a related question from an anonymous attendee. What is the COVID death rate, not the infection rate, for Sacramento County per 100,000 residents? Dr. Beilenson said we have 7 per 100,000 in regards to cases, but what is the death rate?
Yeah.
You know, we have not calculated the death rate. We provide the total number of deaths. So I guess if we want to calculate the death rate, we can divide that by the entire.
Yeah, it should be 3 per 1,000, I believe. Because there are 420 deaths out of 1.5 million. So I think that's about 3 per 1,000, but I'm not sure. We can quickly look it up while we're going.
Sure.
What is the percentage of people who enter the ICU? What percentage of people who enter the ICU survive the illness?
It's changed over time. It's changed over time. Whereas before, like 2 or 3 months ago, and particularly people who are on the ventilators, 80 or 85% of them did not get off and actually died without ever getting off the ventilator, for example, which is not just the ICU. That's a subset of the ICU. But with the better treatment and oxygenation and steroids and a bunch of other stuff, the number of people dying is much smaller. I don't know the exact rate.
There is actually quite a bit of communication internationally regarding the optimal treatment protocols to follow with this disease. And it's been impressive to see that there has been a drop in mortality, but it is still a far more fatal disease than the typical flu. Would you like to address that, what the difference is?
Yeah, and by the way, it was 3 per 1,000.
Correct.
Approximately 2.8 per 1,000. So the flu kills between 12 and about 50,000 people a year. There are hundreds of thousands of cases of flu, actually hundreds of thousands of hospitalized flu patients, and millions of cases a year. So the death rate from the flu is lower than with coronavirus, but coronavirus, which is now around 1% nationally, I think, in terms of the death rate, is significantly higher than the flu.
Thank you. I think this is also a good time in discussion of lethality to talk about the realities in Sacramento, particularly with regard to this concept of herd immunity. I had a question sent earlier by a thoughtful person named Julia Butts, who asked the question this way. Only 1.5% of Sacramentans have been infected after 7 months of restrictions. At this rate, it will take us 50 years to gain herd immunity. What are the other options for herd? What is herd immunity, number one? And what are the best options for how to achieve this?
So herd immunity is when you have enough people that have had the virus or have been vaccinated against it, that the chances are that when you come in contact with someone, they will already have it or be immune, and therefore the spread of the virus goes down. That's kind of in a nutshell. There are two ways of getting it. Number one, like in the wild, if you will, just letting people go about their business as they have in Sweden to a large extent, and get infected and then recover and have antibodies. But you need about 50 or 60%, probably higher than that, a little bit over 60% to have true herd immunity. The other way to get it, of course, is through vaccination, which we are not at yet. So there's been a lot of discussion about herd immunity through infections versus doing what other countries have done. There have been very, very few countries that have done this, gone for herd immunity without vaccination. Sweden is the main one. The jury is still out. Originally, they had many more deaths. The number of deaths have gone down somewhat, so we won't know until it's finally done whether it made sense or not. That being said, they are a very, very different country than the United States of America. Just the fact that they follow the rules, if you will, and people are civically minded to almost to the extreme. It's quite different from the United States, where we'd have a hard time getting people to. We have a very hard time getting people just to wear a mask. So we're still, the jury is still out on Sweden. Other than that, there really have not been any major attempts to herd immunity. Instead, it's been to try and curtail the amount of spread by decreasing the exposure that people have had to the virus.
Thank you. Another question from Nina Withers. There has been a confusion or mixed messages lately by the CDC regarding how COVID-19 is spread. At one point, they said it can be spread via aerosol and then retracted that message. Can it actually be spread via aerosol?
Olivia?
So first of all, what's the difference between the aerosol and the droplet? The droplet transmission occurs when people speak, talk, but because the droplets are rather large, they don't go further than 6 feet. And that's why you hear us talking a lot about being separated from each other at least 6 feet, because that will prevent the spread. With aerosolization, what happens is that the particles that are released into the air are much smaller. And then that means that they can travel much farther, and they can also be suspended in the air for a longer time. And we see that in other diseases, like we often talk about that when we're talking about things like measles and tuberculosis. What we know, and of course we're still learning about COVID-19 and how it acts, but the main form of transmission is by droplet. Aerosolization can occur in certain instances, and that is why when we are giving guidance to hospitals, because of some of the procedures that they do that can cause the aerosolization, they are required to wear a higher grade of PPE but otherwise, in normal circumstances, the main form of transmission is by droplet. I think that the scientists are probably still looking at different studies and data. So that is probably part of the reason why you're seeing some of this exchange and differences in information that is being put out.
Thank you. With Sacramento moving into the red status, I am concerned about school campuses opening again. I believe it is too early for my child to return to school campus at this time. What options do I have?
Olivia.
That's a good question, and one that we have been working with our partners from the schools over a long period of time. And we actually put out our guidance pretty early on. I think what for the parents that are concerned, one of the things that we want them to know is that we have teams that are working together, both from the school and from public health. And we actually hired additional staff to have a team that's dedicated to the schools to be able to provide them the assistance and to be able to act quickly if we are notified of any kind of exposure. So and of course, as we move towards the time where schools can reopen even without a waiver, in which case they can, that means that all the grades K through 12 in about 2 weeks will be eligible to reopen. The schools are working very hard to look at systems of being able to make sure that we look out for the health of everybody, the students and the staff. That's part of the reason why many of them are considering a hybrid system where not all of the students are in school at the same time, and it could take different formats, either maybe morning, afternoon shifts, or certain students come on certain days. And that's to reduce the number of students that are on campus at the same time. The other is, again, to make sure that they still have an option for online learning for those who may not be able to come to the school, maybe because they live in a household with people who are at high risk, or if the student themselves is at high risk, or if the parents just don't feel like this is the right time, that option should still be available. I recommend that parents do contact their schools and look out for information that's coming from the schools, because they will provide details as to how they're going to roll this out.
And here's a question dealing with the expectation that the schools will be open. It says each year, some schools in our district screen students for oral health. We're hoping to do the same this year, but with modifications, of course. Screening for oral health.
Right now, I know that dentists, of course, are able to provide services. And we know that oral health is very important because it's one of the most common chronic diseases that actually impacts a child's health and may lead to missed days of school. So we want to make sure, because the schools is one setting that provides us that opportunity to provide the care. So they will be able to do it, but they have to abide by the guidelines that the dentists are using right now, which means additional PPE that will be required. And we have a couple of schools where we were implementing pilot projects and had teams going into the schools to provide some of this dental care. So I think there will be a role for us to be able to assist with that as well.
I have a question having to do with social gatherings. Please clarify the regulations for gatherings with non-household members. Since it is okay to meet at a restaurant and dine outside with non-household members, that would suggest it is okay to gather with non-household members without masks and without 6 feet of social distancing as long as it is done outside. Does this mean that extended family gatherings, social groups, book clubs, etc., can meet, enjoy meals and conversation without masks, without social distancing, as long as it is done outside?
No. The simple answer to that is no. Olivia can chime in with this as well, but the guidance, we have not really gotten guidance from the state specifically on those two issues. So what we've been saying, again, with the moving Sacramento to orange, we want indoors. We want you to be indoors with no gatherings whatsoever with anybody outside of your immediate family bubble. If you're going to have any gatherings outside, they must be socially distanced, they must be with masks, and they should be with very, very few people. Olivia?
Yeah, at this time, because that is what actually got us into trouble in the first place, is when people were gathering, and oftentimes this was gatherings in private homes without social distancing and without face coverings. So at this time, we do not encourage that at all. In fact, with the guidance that we're putting out is please, as much as possible, keep within your household. So some of the activities that you have mentioned, we ask that you hold off until we get to a point where it will be safe enough to have those gatherings.
And regarding gatherings, when will churches be authorized to open for indoor services?
So with red, churches are now able to open 25% of capacity or 100 people, whichever is less. An orange is 50% or 200 people, whichever is less. And I think when you go to yellow, it's open for good. But again, we really, really want to make sure people use masks, socially distance when they're in church, and right now not to sing, because singing is a way of aerosolizing or dropletizing, if you will, the virus.
Thank you. So here's a question about reporting, I think. It's an anonymous attendee who asks, what process is in place so that Sacramento County can prove that the reported positives have come from hospital admits in our Sacramento County hospitals? Some come from individuals who reside in Sacramento County versus outside. It is reported that many of the hospital admits come to Sacramento County hospitals for higher levels of care as an interfacility transport from hospitals outside our county.
Olivia?
Okay, sure. So yes, you bring up a good question as to how do we report cases. The cases are reported to public health based on the place of residence of the person. So even if they are transported into Sacramento, the reporting will still go to the county that they came from. And that's why we are very dependent on people providing accurate information about address. So the ones that we report on our dashboard are only those that reside within Sacramento County.
Thank you. Here's a question from Patrick McIntosh. How are we applying new knowledge in changing our tactics to combat the virus without expanding the unintended consequences of our earlier actions? And he's stressing the depression and anxiety and minimal learning going on among our students, reducing their ability to compete in the workplace, and the irreparable damage to businesses and to the lives of their employees with the subsequent stress on families.
So we're trying to, so we've been on kind of two roller coasters. We were originally in March and April and early May, the lowest case count, case per 100,000 among any major urban area in the entire United States. So we were kind of congratulating ourselves. We opened up fairly significantly in late May, June, and July. As Olivia said, there were a lot of gatherings that kind of sparked a lot of the infections to the point where we were having by far the largest number of people infected were 24 to 45, 49. as opposed to seniors or those with underlying or those at most at risk. So we then have kind of cracked back down. We were purple, which put us in a more restricted manner. And we went from the highs of about 300 hospitalizations and about 80 or 100 ICU beds down to where we are now, which is about 119 and 31. So we kind of have gone down, up, down. And now that we're opening up again, we want to be, we should have learned about what our lessons have been. And that is, again, to be much more judicious as we open. That's why I support what the governor has done, which as you move up the chain of colors, you can open more widely, but initially it's quite small. It's a small chunk, 25%, then 50%, then 100%. And so that I think makes sense. It's helpful to the economy, obviously, because it's opening things up, but it's not making it unmanageable from a public health standpoint, where we're getting deluge with 200 or 300 cases a day, which was the case back a few weeks ago, several weeks ago, where again, contact tracers are not able to keep up with the number of cases, et cetera. So I hear what he's saying. Olivia and I and our staffs are extremely, excruciatingly aware of the balance between the economy and reopening and the kids in school and people who are isolated and depression, et cetera, that occurs from things not being open. And so we're trying to kind of thread the needle, if you will, by moving us as quickly as possible from purple to orange and maybe even to yellow, where we can open up the economy much more and the business sector much more. We can open the schools, but do it in a safe way.
Thank you. Erica asks, I want to confirm that Dr. Beilenson said seniors and essential workers get vaccinated first.
I said seniors and healthcare workers, but that's to be determined. That'll be from the federal government or the state government. I don't think it'll be from the county, unless I'm wrong, Olivia. That was just my surmisal.
Yeah, we'll get our guidance from the state, and there are discussions about that. A lot of it will be driven by how much vaccine is available.
Right.
Definitely first responders, healthcare workers. And the reason for prioritizing seniors is because they are the most heavily impacted. When you look at our deaths, over 75% of our deaths are in people over the age of 65. So definitely we would want to make that we're able to protect them. And of course, there will be some kind of decision tree about who else. For example, those with chronic conditions also will be prioritized.
Thank you. There's a question from Clifton Billings. He's asking, why does Red Tier 2 allow shopping centers to be open indoors at maximum 50% capacity, where there isn't a way of contacting individuals if they're exposed to the virus at the mall? Whereas in contrast, places of worship can only be open at a maximum of 25% or 100 people, whichever is fewer, where attendees can usually be contacted individually in case of exposure. What data or criteria was used to establish these specific figures?
So there's nothing is perfect about this by any means. There's a lot of lobbying by different groups, which I won't mention. But I think the analysis behind the difference between churches and malls is that the malls have much more open air. I mean, yes, obviously churches are open air to some extent, but much less so. And they have doors to the outside, and it's much more, the air is moving around much more than it is in churches. That's my guess, but again, the difference is only 25 versus 50%. And so there's nothing it's not 100% consistent.
One other thing about the malls is that usually the interaction between individuals is brief, whereas when you go for a church service, some of them minimum 1 hour, some go on for several hours. So much more likely to have an exposure in that kind of setting.
I think a lot of the issues in closed spaces have to do with ventilation. And I'm personally wondering whether there will be resources put into helping places of worship and other indoor spaces to improve their ventilation systems to make them safer.
Olivia.
You bring up a good point, but I'm not aware of resources that have been set aside for that.
Okay.
The plan that we have right now, actually, Dr. Beilenson mentioned that we receive money from the Board of Supervisors, and our focus has been on places where we are seeing a high number of cases, as well as disadvantaged communities, because we have found that oftentimes, even when we try to ask them to isolate, these are individuals that would have a lot of hardships in terms of being able to meet our health officer orders. So being able to provide them with the services to assist with that, that has been the focus.
Thank you. Here's a question a little bit off COVID. Will drive-in clinics have enhanced flu shots? I called a few weeks ago and was told they would not.
Olivia.
I'm not sure which clinics you called, but I think a good place to start would be with your healthcare provider, as well as many of the pharmacies are also going to be providing flu shots. The county also has several scheduled flu shot clinics. So if you go on our website, COVID-19 website, you can look at the sites and the dates. And
They were talking about the extra strength for the
for the seniors.
Yeah.
I believe that there are some limited number of those available. I don't know how many of them are available in drive-thrus. I think the best is to be able to check before you get there and make sure that they have it.
Very good. I was just at a very high volume Kaiser site that had the enhanced vaccine available, but that may not be true everywhere. Here's a question. If the question is whether the undocumented will still be supported or paid to be in quarantine if they are exposed or infected. This is for
agricultural workers. Yes, I believe so.
And I want to add that we do not ask about somebody's immigration status when we're providing care, because our goal is to make sure that we meet the need and also stop the spread of the disease. So we do not ask about the status, and we just provide the assistance as the need arises.
A question, is it possible to get data on the number of Latino deaths from COVID-19?
Yes, that is available.
Is that on the dashboard?
I have to mention that there's a lot of data that we could put on the dashboard, but we had to select what we felt was would provide the most information. So some of the information that you're asking about deaths by race, ethnicity, that we do have that available, but if we were to put everything on the dashboard, you would spend the whole week just trying to look for the information. So we do look at it definitely, but we don't, right now we don't have it on the dashboard.
One of our attendees is asking, how is or how should the influenza wave that's coming or second wave COVID illness data be taken into consideration when reopening schools?
Well, we normally deal with flu in the schools, and so if there are an excess number of cases in a classroom or whatever, we actually will potentially shut down the classroom or even the school. So I think the same thing is true with COVID. We have plans in terms of cases of COVID in cohorts or whatever, what to do with them. I thought it was going to be a different question about the flu. Let me just throw in a couple points about the flu. As I think you mentioned last time, Steve, the Southern Hemisphere has had a very limited amount of flu, and they had the flu earlier than we do, because their winter obviously is in our summer. And they think it's a little bit of luck, and B, because people are wearing masks and socially distancing already for COVID, which obviously helps in terms of preventing the flu as well. But I'll leave Olivia, if you had any comments on the school issue.
So just to make sure I understand, they're asking about how we're preparing for the flu in schools. Was that it?
How that the upcoming flu wave that's coming is going to impact the decisions about opening schools.
So the decision about opening schools is really based on our COVID numbers, but we are definitely very aware of the fact that we need to take the flu into consideration. And we've been working with the schools. Many of them are prepared to be able to provide the flu shots, and we will be working with them and making sure that we provide the flu shots as well for the students as well as the staff at the schools.
You should point out, in terms of the schools, the staff are being tested every 2 months in total. Smaller numbers are every couple of weeks, but in every 2 months, all the staff will be tested. And we have contact tracers directly on call, if you will, at the schools to help deal with any kids that get test positive or that get symptomatic, to be able to deal with it at a school-by-school level.
I have next a fairly challenging question. Why do you advocate for influenza vaccines when there are studies that show the vaccine increases the risk of respiratory viral infection and increases the risk of coronavirus by 36% in the Pentagon study?
A, I have not heard of any of these studies, and B, the flu vaccine, even when it doesn't work terribly well, even when it's 30% or 40% effective at preventing a case, it's much more percent of that, a much higher number of that actually decreases the severity of the illness. So we're a big proponents of the flu vaccine. Olivia, have you heard of any of these studies?
No, I have not.
Nor have I. Will there be increased enforcement and/or outreach for businesses with these newly expanded indoor activities to ensure safety?
So we have a three-part enforcement paradigm, if you will. The first is education. We're using our business navigators and environmental matters people to do the restaurants, and our business navigators to do the other businesses in the town. They do education. If they find that the people are either purposely or continuing to not follow the rules, they will do enforcement in terms of written warnings. And then finally, we can actually go to the appropriate organization in the state level to be able to shut down restaurants or workplaces that are just flagrantly not following the rules.
Robert Hickman is asking, has there been a tracking of COVID in the homeless population? How is this group being supported?
Olivia?
Yes, we have a team that's been doing testing in the homeless, and actually we also have a project where they were providing housing for this population to make sure that we are, one, able to reach them, and two, also if they did fall sick, that we are able to isolate them. For the testing that we have done about 1,500 tests so far, and we've had 20 that were positive, and there was no outbreak in any of those situations. These were just random tests that came back positive. So we feel that I think the project that we've put in place and the services that are being provided are helping to protect this population.
Very good, thank you. So here's a question really having to do with your data collection. And the anonymous attendee is wondering whether the counts of cases is accurate. The question is, if our tests are being done more than once, are people being noted 2 or 3 times in the sums?
Yes, good question. Our epidemiologists actually go through a very tedious process in doing what we call data cleaning. Because when the data comes in, those are some of the things they look for, is inaccuracies in addresses, dates of birth, and then also looking for, they have a system, software that they use to actually be able to remove any duplicates. So when we're counting our positives, even if a person went to one clinic in the morning and another in the afternoon and got tests a few days or hours apart, our system will be able to make sure that that is counted only once.
There are people out there wondering about the distinction between people who die from COVID-19 or people who die with COVID-19 from some other underlying illness. Perhaps you could walk us through that.
Yeah, so there's been, that we hear a decent amount. If you look at the studies that have looked at the number of excess deaths in each jurisdiction, there are overwhelmingly more than you would even expect with COVID. So the bottom line is the vast majority of people with COVID who die of COVID, who die with COVID, die of COVID, if you will.
I also want to point out that when we get the report of a death, we actually wait for the death certificate. And if the person was in the hospital, we also get the medical records, and all of that is to verify that whatever the cause of death was directly related to COVID. And for those cases that go to the coroner, also our coroner communicates with us very regularly and provides us with information. And they also have to do an investigation to make a determination of the cause of death. So it's not just a simple checkbox. There's a lot of work that goes into verification. So I know that that's a question that's come up several times, but as one who actually does part of that review, I know that almost every single one of the ones that I see, it's related to respiratory symptoms, heart disease as a complication of COVID, and other complications as well. So I know it's something that people talk about, but it has not been validated.
Right, and I think the reality is that the epidemiologists have shown that there has been tremendous excess death, particularly during the summertime, beyond what would have been expected during that period. And those are almost always attributable to COVID-19. But I guess one question that also comes up that's been mentioned here is about people who did not go to the doctor because of the scare of the epidemic, the pandemic, and died from heart disease and stroke and other morbidities that might have been taken care of in normal times.
Yeah.
Do we have any way of measuring the numbers of people who died?
That's sort of by looking at the excess deaths over what you would have expected, but most of those are due to COVID. I can tell you that, at least anecdotally here in Sacramento, even from the very beginning, we were allowing outpatient visits to the doctor, et cetera. So although some people may not have come in, and someone who had, although I must admit, if someone had severe chest pain, I think they would still call the ambulance and go to the ER. I don't think there are very many people who would have not done that and would have died of a heart attack instead. So I don't think that that's a terribly common occurrence. It may have happened a few times, but at least anecdotally, I don't know of many of them.
I think the latest number I saw was that there have been about 500,000 children infected by the virus nationally, but that the death rate is quite low.
Very.
Talk about the role of children as transmitters of the disease.
Olivia?
That's another question that we're asked quite a bit. And as we're learning more about COVID-19, we're learning more about the role and that it plays in children and how it impacts children. I have to point out that very early on when COVID-19 started, the decision to close schools, and I believe that that actually protected the children because many of them basically stayed home and were protected. But now as we are opening the schools, and especially from information we're hearing from other places, we know that children can get infected. We also know from studies that have been quoted in some of the CDC data that's provided is that children can also spread the disease, and that's the reason why we want to be really careful as we move towards opening the schools, because it's not only the children we're concerned about, but also the adults that have chronic diseases that might put them at risk for severe illness. The other thing also with children we have learned is that most of the time they have mild disease, but we also have learned that they can have severe complications. And I think in Sacramento, we've had one case of that where it's like they have an immune storm and the immune system just goes crazy and starts attacking all the organs of the body. So it's very rare, but it can occur. And it's something that we want to avoid at all costs because it can be deadly.
Thank you. Let's switch over to some detailed, complex questions. Has there been any study on whether or not disinfection by fogging using appropriate active ingredients is known to work effectively? And what would be the appropriate active ingredients?
Let me take a stab at this first, and Olivia join in. As the studies have gone on over the last several months, I think it's pretty clear that the amount of emphasis put on fomite, which are solid objects that you touch, like elevator buttons and stairway railings, etc., are much less of a concern than they were originally. It's not to say you shouldn't wash your hands or sanitize your hands after touching the bars at a playground and things like that. But I think it's been well proven now that there are three really important things: wearing a mask, socially distancing, and not gathering or having not gathering. And so the way you get this disease in large amount, in large number, in general, is a serious exposure, is without a mask, face-to-face, less than 6 feet for 15 minutes or more. That's how you get this virus. That's the bottom line. That's really what we're trying to prevent. So I think fogging has been shown to potentially work at decreasing the amount of viral load on what remains. But the virus starts denaturing very, very quickly, like within 20 or 30 minutes of being out on surfaces. And again, we don't want to take away from focusing on the really major ways that you get this virus. Again, not to say you shouldn't wash your hands. You should sanitize, but I don't think you have to go crazy about cleaning up the rooms. Olivia, you want to add anything?
No, I think you've covered it.
Do you have any information about active ingredients that are recommended for the defogging?
I don't.
All right.
That's more a question for people in environmental management. and we could ask that and see if maybe next time we can provide that information for folks who are interested. But basically, it's a disinfectant. So.
Another question, how is it that cloth masks don't work for smoke particulate, but works for a virus?
It's I don't know what the viral size is. Is it under 2.5 microns, Olivia?
No, and that's the reason why the cloth masks are effective, because the other thing is that the virus is carried on particles, and so that's what basically we're able to stop. And we've been talking about droplets, so that's what basically the virus is carried on. But with the smoke particles, because they're really, really small, they can go through the material. And so that's why the N95 is the one that's effective for the smoke, especially when we're talking about the 2.5 microns of particulate matter, because that's the one that can go really deep into the lungs and cause problems.
And that comes from smoke, correct?
Yes.
Thank you. Amanda Turkbergen asks, what is the current recommendation for how frequently people should get tested for COVID-19, and which type of testing is recommended?
Well, every day. No, I'm kidding. It really depends on who you are, what kind of work you do, how much you're out in the public. I mean, if you're someone who's been staying at home since the beginning of the outbreak, I don't think you need to get a test. If you're a healthcare worker, you should probably be getting a test maybe every week or so. It depends on what your healthcare place, your workplace encourages you to do. The test that we use uses the what kind of machine is it? It's not the rapid testing where you do saliva and it's good in 15 minutes.
PCR.
That what?
It uses PCR.
PCR, right? PCR tests. The PCR tests have proven to be very, very effective and very have really good results. And because we're now able to get the test back so quickly, whereas we weren't a couple months ago, it was like 5 to 10 to 15 days, which is basically worthless for our purposes of contact tracing. We're now able to get the test back rapidly enough, and they're very effective, that we think that the PCR test right now at least makes the most sense. The PCR test is for the viral test itself.
Here's a question from Patrick McIntosh. How are we tracking the mental health consequences of the quarantine, both in children and adults?
Olivia?
Sorry, could you repeat that again?
How are we tracking the mental health consequences of the quarantine, both in children and adults?
So mental health, that's being tracked by the healthcare providers. It is not reportable to public health. So although we have gotten anecdotal reports of, and of course we know medically that keeping people in isolation does have some mental impact. But apart from the anecdotal information that we have, there are no reports that are available right now. Usually the way it works is that we get information at the end of the year from hospitalizations, and this is a data set that we get from the state, and that would provide us some information on numbers. But right now we would be dependent on the healthcare providers who are providing that care, but we don't have a central way of being able to get that information right now.
I think it is important to point out that our public health officials are very aware of the stresses on children and also on the educational setback for children who have had difficulty with distance learning. These are well-known consequences. The problem is how to balance that with
Right.
the health risks. And it's obviously there's quite a bit of public debate We're all hoping that the kids can get back to school ASAP. But speaking of that, what is the plan for handling children who are knowingly sent to school sick without disclosing the illness? This happened frequently before coronavirus, and there is no indication parents will change this behavior, even knowing how dangerous coronavirus is.
Good question. So one of the things that is included in the protocols that the schools have put together is how to handle children that start exhibiting symptoms at school. And they all have to have, or in their plans, have to include a place where they can isolate the child. And they're going to make sure that the parents actually also make sure that their contact information is up to date. So they will be asked to pick up the child and take the child home. And the other thing also is that if there is a need for testing, they can work with our public health team to expedite the testing for that individual.
Thank you. Here's a good question from Suzanne Mancuso. My profession within the school requires me to work for extended periods of time, 1 to 2 hours, with a student in close contact, only 2 to 3 feet away. Is this safe for myself or the student, even if we wear masks?
For the schools, one of the things that we've been discussing a lot about also, and that has come up, what do we do in situations where they are not able to maintain the 6 feet of separation? And that's why it's really important to hone in the message about making sure that parents check their children and make sure that they don't send their child sick to school. And of course, the adults too need to check themselves. The other thing that we are looking at also is, of course, wearing a face covering helps in those situations. And then also being able to maintain stable cohorts, because if we do have to quarantine a group, at least if we know that it's a cohort and it's been stable, we can focus on that instead of having to send the entire classroom or the entire school home.
And Patty Lee is asking whether you would recommend any other PPEs for service providers in that kind of setting.
I don't know, Olivia, you can chime in as well. You mean a setting like that was just described?
Well, someone who
Or similar?
Someone who works in the schools in a very similar situation. And the
Yeah.
question is, other than or beyond masks, would you recommend that service providers wear any other kind of
Yeah, I mean, I think face guards, those face shields are actually somewhat helpful. I don't think wearing gloves is not particularly helpful. In fact, we actually don't recommend gloves because people don't change them from person to person, particularly like in restaurants, for example. It's better to wash your hands each time between serving. So I would say a face shield. I don't think gowns particularly would make a difference, but maybe a face shield, Olivia, do you think?
A face shield could be helpful, but I think they need to realize that the face covering is still the most important.
Yeah.
And let's stress the hand washing in those situations also. It's very
That's
difficult
important too,
not
yes.
to touch your face, but maybe the face shield will help with that.
Yeah.
So here's a question really about vaccine. When you speak of the vaccine, are you only referring to a vaccine that is made by the federal government? Are private healthcare providers also developing their own vaccine? And how will that be given out? Do private companies decide for themselves who gets it first?
So first of all, it's not federal government. It's all, from what I know, it's Moderna and Pfizer and all the big pharmaceutical companies that are working on these immunizations. It really depends. The government should buy up everything, and they are putting out money now to kind of gin up production of certain of the vaccines. But we would hope I mean, I in the old days, it would have, you know, which is like 2 years ago or 3 years ago, things would have been a certain way. I can't guarantee it, but what should happen is the federal government should take ownership of all of the vaccine and should be parceled out to the states in an appropriate manner with appropriate with serving certain groups first.
That's our expectation, yes.
The federal government, as you said, is pouring lots of money into development, and they will help tremendously with the distribution. But I think people have to remember there's more than one company making these vaccines. And
Yeah.
I think a few months from now, the question is going to be, do I take the Moderna vaccine? Should I take the Johnson & Johnson? So we'll have other questions down the road. All right, is there anything in the California Department of Public Health guidelines that allows schools to increase the numbers of students on campus as the county goes from red to orange to yellow? Or is the idea that the current guidelines, such as the 6-foot physical distancing that reduce the number of students on campus, remain in place throughout each tier?
The guidelines are the same for each tier. Once we get to the red tier and we're able to open, the guidelines remain the same. So it will be dependent on the plan that the school puts in place. And my understanding is that many of the schools are looking at being able to reopen in a phased way. I don't have the details right now as to what that will look like, but it's not dependent on the tier.
Steve, let me do a little something on immunizations. Oh wait, never mind. I forgot. Forget it.
That's all right. Do you know how soon after being vaccinated the vaccine will be effective? Will you need 2 shots?
Yeah, so that was what I was going to say. Sorry to grab it, Olivia. I just forgot what I was going to say. We don't know how long until it's effective. The flu vaccine is 2 weeks. By the time when you get it, within 2 weeks you have the immunity for it. We don't know with these vaccines yet. They're still in studies, and some of them have been phase 3. Most of them are in phase 2. But it's important to point out that even for Sacramento County, and if you figure with 1.5 million people, and if you figure 3/4 of the people will get the vaccine, which is a little bit high based on polls. Polls are showing only 60 or 70% of people are going to get the vaccine. But if you get 75%, that's 1.1 million doses that have to be given through vaccinations. If it's just 1 dose, if it's 2 doses, it's 2-point-something million vaccine doses. So it's going to take a while to get the vaccine out, even in the best of all possible worlds.
Thank you. Here's another kind of a detailed question. Regarding ventilation, how much does hypoallergenic filters help with the air circulation and the claims that they filter over 90% or more bacteria, etc.? They are costly, but do they really help?
Well, bacteria are not viruses. Viruses are smaller, if I'm not mistaken. And so anything that's advertised that says 90% of things are taken care of, I just don't believe unless I've seen studies about it. So I have not seen studies about it, but maybe if Olivia has.
I agree with you. I'm not sure about the effectiveness.
And I think it would be wise to be skeptical of those
Yeah.
ads. So Leslie Napper asked this question. Dr. Kasirye, are there neighborhoods within our county that are not doing so well? And what can we do to get the messaging out to heal and educate our community members and support wellness in those neighborhoods?
Thank you. So if you look at the dashboard, you will see that there is a map that provides information by zip code. We also provide a list of the cities and show the number of cases by city. And that does give you an idea of where we're seeing the high numbers. And so this, along with additional information we use in order to target some of the interventions. For example, the way that we decided on where to place the community testing sites was based on that information of where were we seeing cases coming up and where were we seeing a need. So in terms of doing outreach, we also are planning to do more outreach to especially those communities that are not as easily accessible to us. So in being able to do this, we have partnered with community-based agencies that are trusted in these communities and are able to help us with taking that message.
Thank you very much. We have two questions I'll put together. I want to clarify that it was said that all schools being reopened will need staff to test for COVID every 2 months. And the second person is asking, will this be voluntary or will this be required of people in the schools?
It's voluntary.
Deploying a vaccine to our large population will be difficult, as Dr. Beilenson said. Who's responsible for that? How will it be done, particularly if the vaccine takes more than one shot?
Well, we have, I'll
Go
say
ahead.
that, well, we have plans for that. So there will certainly be, the CVSs and the Walgreens of the world that should be giving it. There will be the public health division of the health department doing it. We're working on getting 2 trucks and 2 trailers that are going to be outfitted for serving folks and getting the vaccine out. There'll be kind of an all hands on deck because this is going to be an unusual. I guess I wasn't alive, or I was a tiny baby when the Salk and Sabin vaccine came out for polio, but I gather it would be kind of on that level. A huge. Actually, no, it'd be much bigger than that because that was just kids or young people. We're talking about a massive attempt to immunize 70% of our 330 million people. That's 220 million doses. If it's just a 1 dose that we have to get out to people, it's going to be an immense effort. Obviously, public health leads it for the county in Sacramento and in other counties in California, but it's not going to just be the public health department that's giving the vaccine.
I remember very well standing in my schoolyard in elementary school, waiting to get my sugar cube for polio. And what I recall from that time is that there was almost uniform acceptance around the country that this was a necessary thing for the children. And polio is scary, and so is COVID-19. So we'll hope that people also agree. Let's see. This is from Crystal Sanchez. Being out in the camps, we know people get sicker in the winter due to rain and no shelter. How does the temperature shift affect COVID?
I don't know if we know yet.
Yeah. Well, from what we've seen so far, it doesn't seem to affect it because this all started off in January, and folks thought that, oh, when the warmer months come, that it's going to get better, but it did not. So it seems to be independent of the weather.
Well, some folks thought it would get better. Some folk thought it would get better.
And the truth is that there's a confounding effect of everyone moving indoors because of the cold weather.
Right.
So we've all taken advantage of distancing outside.
Right. I think Crystal's referring to the encampments that she works with all the time, and it's the question of what's going to happen to the people in the encampments during the winter time, which of course is more fortunate in Sacramento. We're fortunate that it's nowhere near as bad as back east, for example, but it's going to be an issue.
So I think many of us are looking forward to expanded indoor dining. And one question from an anonymous attendee is, will there be requirements for the staff of these restaurants to be tested periodically?
So right now, testing is not required for people who work in that industry. Of course, if there is an outbreak or if is an exposure where there's a known case, they will get tested at that time. But we do not do serial testing in that setting. The only I guess professionals that have had to do serial testing are those that work in the long-term care facilities. In fact, right now, they have to be tested weekly. And that's because of the people that they serve that are such high risk. I understand also professional sports, they do a lot more testing. It might be even more frequently than weekly, actually. But those are the only ones, and then the others, it's not as frequent and it's not required.
So over these months, those who are immunocompromised, many of the elderly and many with pre-existing conditions have pretty much tied themselves to their homes. At what point should they feel freer to come out into the communities?
Well, there's a full, almost a third of Americans have underlying conditions. Actually, about 102 million people do out of the 330 million people. So I think it kind of depends on people's risk status, how they feel about risk. It's a modest risk to go out. Obviously, I wouldn't go to a restaurant and eat with someone who's not a member of your family without a mask the entire time. Whereas if you were going to a coffee shop with your child and everybody wears masks and everybody's 6 feet apart and there's only 10 or 15 minutes that you're there, that's a different story. So it really depends on your risk tolerance in a large extent. Now, if you have a severe immunosuppression thing like a leukemia, your leukemia, and you're on anti-leukemia meds, I would obviously try and stay in. But if you're just someone who has kind of COPD or asthma and you're 56 years old, again, it depends kind of on your tolerance. Olivia, do you have anything to add?
I think as you've said, it really depends on what the tolerance people have. But I think we need to recognize that until we get to the point where we have the vaccine, our lives are going to be changed in terms of how we have to have a modified way of living right now. For example, having to wear face coverings has to be part of our lives. And also, we do need to think about the trips that we make and whether we really need to make those trips. And I think, again, gatherings, especially with people outside of your household, those are things that people need to avoid as much as possible. There might come a time where we've controlled it enough where we can say, okay, fine, maybe these types of gatherings are okay. But right now, I think people still need to be careful and think before they go out, whether that's a trip they need to make or not.
And Steve, I have a correction that I wanted to make. When they were asking about the death rate per the Sacramento County, it's 3 per 10,000. The 420 deaths for 1.5 million people is 3 per 10,000. But the death rate, the number of deaths for the number of cases that we have, is 1.9% in Sacramento County.
Okay, thank you. So Tammy McCarley is asking, I'm interested as to the plan for guidelines surrounding outdoor youth sports. If the disease is not found to be spreading outdoors and a sport can be conducted with social distancing, could we expect certain youth sports to be released for scrimmages and games in the spring?
Very soon, we hope.
Yeah, I would say the same.
So that is the hope. Thank you. Tan Tung is asking, what's the protocol for the community if they are tested positive? Does the county get the record and monitor these individuals with contact tracing? Or are they advised to quarantine themselves? So how has that changed over time?
Yes, good question, because when we had the spike, we got to a point where we were not able to get to everybody on time. So we actually asked our healthcare providers that if they were going to test somebody or give somebody their positive results, that they would give them the instructions about isolation. But fortunately now, with the reduction in the number of cases, as well as the increase in our resources, as mentioned, we have about 100 people now who are available to do the case investigation and contact tracing. We're actually able to get to every single one of those people because we're getting about 100 cases a day right now. So we have enough to be able to contact everybody and also find out who their contacts are and make sure that they quarantine as well. So as Dr. Beilenson was saying, as the numbers go down, we are in a much better position to be able to make sure that everybody who gets a positive test actually gets the appropriate attention that they need.
Joy Vickers is wondering again about herd immunity. Can people catch this a second time? What do we know about reinfection rates?
So we don't know yet. You certainly get antibodies. At least 70 to 80% of people get antibodies if they recover from the illness. My mom is 86, 87. She got it a few months ago, and she actually tested positive for antibodies. Whether the antibodies last for a period of time, we don't know yet. Most viral illnesses, it's good for at least 6 to 12 months, if not much longer. In addition, there are T cells, a specific type of immune cell, which may kind of go underground, and then if it's exposed to COVID again, may come out and deal with it, even though you don't have antibodies against it. All of that goes to say that we are still learning a lot about this, and we don't know. But there's certainly, most people do get antibodies for at least for a period of time.
But it also turns out that not all antibodies are the same.
Correct.
So, and these are areas that are still being explored. There is one company, at least, that has produced a monoclonal antibody against COVID. And what they're claiming is that their particular antibody is more powerful than some of the antibodies produced by people naturally. So we shall see. There's a question about what do we do as individuals if we see that a business is not following health protocols?
So
can we go ahead, Dr. Beilenson?
Yeah, so it's very simple. Call 311. 311 farms out all the cases of the number of complaints against an institution or an organization or a business every single week. I get them. I think Olivia gets them. Our EMD people, our restaurant folks, inspectors get them, and our navigators get them. And we go out to gyms and to tattoo parlors, et cetera. I've been to many of them. And again, I'd say 95% of the time, they get educated and they behave themselves. And if you go back and check unannounced, you find that they've been behaving. For the small number that are not behaving, we get, as I said earlier, you can get a written warning. And if they still are flagrantly not playing ball, they can get actually closed down. But please report them to 311.
Right. I thought last time you gave out your home number.
I think I maybe did, but I'm not doing that this time.
All right. Well, we're at the end of our program. It's almost 7:30. There were about 150 people at one point, quite an audience listening. There were lots of questions, and unfortunately, we were unable to get to all of them. We appreciate all of those who sent questions in. These are tough, and we recognize that there are many out there in the communities that are asking the exact same questions. One thing I can tell you is that the county at this point is making a commitment to offer these kinds of programs about every 2 weeks. So these should be posted and available. And at the moment, I think it's going to be on Thursdays every other week at 6 p.m., just as this one was. And we invite you to come back and ask your tough questions, and we hope we could be helpful in answering them. So thank you to all, and we'll say good night.